Good evening and welcome to a brand new episode of our weekly program, The Week in 30 Minutes. The English News Department has prepared a variety of reports that highlight the main events which are currently at the forefront of the news. Our committed team of reporters has visited some of the latest campaigns, conferences and spectacles to ensure our audience remains updated and current.
Today's episode takes us to a number of major local events that recently took place across the country, including a reception arranged by the U.S. Embassy in Kuwait to preview the highly anticipated and upcoming Mozart opera. The opera is organized by the Ahmadi Music Group and will be performed by Mozart's classic Don Giovanni. Today's episode also includes the colorful and rich inauguration of the 27th Joint Artistic Exhibition. A variety of other reports with a cultural flavor will also be aired in today's program.
Today's episode welcomes special guest Dr. Suad Abul, who is the head of Pediatric Surgery Department in Ibn Sina Hospital. Dr. Suad will discuss a range of issues with us today pertaining to the recent Pediatric Many Medical School graduation of 2016.
During our first segment today, we will chat with Dr. Suad and ask her all the questions that spring into mind regarding the study of pediatrics. The second segment of today's episode will include our pick of local reports prepared by our team of reporters.
Welcome to our show tonight, Dr. Suad. It's our pleasure to have you with us.
Pleasure is mine. Thank you very much.
Thank you.
Welcome to the show.
Thank you.
Dear viewers, stay tuned with us. We will be back shortly to start our discussion.
Again, welcome to the show, Dr. Suad. We talked a little bit earlier about pediatric medicine. You are a pediatric surgeon. Can you tell us a little bit what is pediatric medicine? What is pediatric surgery?
Sure. So first of all, thank you for the invitation and the show. Regarding the pediatric specialties, of course, we should distinguish pediatrics from the adults. So because they have different pathologies, different diseases that in the management, of course, and dealing with these kids is different than dealing with the adults. So the pediatric specialties is medicine or surgery, and it's concise of taking care or management of the pediatric group from neonates up to age of 12, sometimes 18 in the North American countries. So in medicine, of course, everything, the heart, endocrine, lungs, and all the GI diseases, everything. And in surgery, of course, all the different subspecialties we have now in Kuwait, the general pediatric surgery, cardiac surgery for pediatric, neuro surgery, urology, orthopedic, ophthalmology. Of course, every specialties in the surgery, there is a specialty for the pediatrics.
This is a very important field, obviously. Yeah. You have also an annual event called the Pediatric Mini Medical School Program. Can you, this just took place, can you elaborate on this program?
Actually, this is an idea that came from two pediatric doctors who specialize in child development, Dr. Hadid Al-Faras and Dr. Nahida Al-Atiqi. And they came with the idea that our community and our parents, they need an awareness in management or knowing the diseases in pediatric. So they did this event yearly, and it's been there for the last few years. I think started 3-4 years ago. And every year there is a few a few topics that they concern about, and it's changeable every year. It takes about 5 weeks. Every week, every Monday, they do 2 to 3 lectures. And my role actually this year was talking about what's the important in the field of pediatric surgery and how the mother or the parents can deal with some injuries inside the house, what the common pediatric surgery complaints that they should be aware about, and when to take the kids to a pediatric surgeon.
What is the most common? You just mentioned.
Yeah, so there is the common, what we say, like the bread and butter of pediatric surgery. It's of course the inguinal hernia and the undescended testes.
Really? At that young of an age?
Yeah, we see it actually more common in the neonates and in premature babies, because the muscles and the area, the inguinal canal or the inguinal area, which is the area just between the abdomen and the hips, it's underdeveloped, and sometimes these lumps and bumps happens there. So we want to give the community and the parents awareness, because unfortunately until now we see some of the mothers comes to us and she's worried, but her grandmother or some other older person in the family tells them that don't worry, it will close by itself. Don't take the parents, the patient to the surgery or to the hospital. And we see actually just yesterday I was on call and I had a kid who came in with incarcerated, where the bowel is actually stuck inside.
How old?
He was 1 year old.
Oh wow.
So they waited on this baby, and of course it did not close, and they came because the bowel is stuck in that defect, and thank God we took it right away and without any problems or damage to the intestine or his bowel. But this is the things that the more you talk about and you think that people knows about these things, the more you discover still we need the awareness. So these events actually, it helps.
Is it easy to diagnose? Is early diagnosis important?
It is important, and actually every pediatrician who examine this patient will examine, or the kids will examine this area, and actually the mother is the most important person who would tell us if she finds something. Some of them she's worried and she heard about it, or she saw, for example, her friend's kids has it, and she's worried. She comes to us just to check. But the parents, when they change the diaper or do a bath for the kids, they are the one who actually discover a lump or something unusual. So we always advise them to ask. Yeah, we ask them also if they saw something abnormal.
Right. Dr. Saad, being a speaker in this event, especially in its third edition, what were the nature of the topics that you discussed during the program? So
I first of all did an awareness about the pediatric surgery, because unfortunately I found that still, especially on the Twitter sometimes, that the mothers will ask an adult surgeon about the disease in pediatric. And of course, if the doctor has a private, of course, in the private they want to do everything. With my respect to my all colleagues, but sometimes, unfortunately, we see that the mother takes the kids to an adult surgeon or adult physician to talk about, or to show him the problem that the kids has. So I want to make sure that what's the field of a pediatric surgery. We are subspecialized doctors or surgeon. We did general surgeon, and we subspecialize in the pediatrics. So the pediatric surgery has a lot of different pathologies, has a lot of different diseases that we deal with, because the kids present differently. And there's a lot of congenital anomalies that they have that we should, or the family should be aware about, and cannot be dealt with or managed by an adult surgeon. The type of even the psychology of the kids. It's different. If you are an adult, you deal with an adult. It's different than when you're an adult. Yeah, exactly. Right. Like you are a parent, and of course you deal with 1 year old different than the 14 or the 16 years old. So there are different levels that you have to talk to. And the kids, they don't talk to you. if they have pain, they don't talk to you. They don't say this, it's pain here or there. They just by the expression or their fear. So this is we deal with it every day, and we know the psychology of the kids. So this is different. And of course, like, you know, there are certain things that we advise for the parents, how to take care of their kids and what to do. And I think the pediatric surgeon is the most closer to the pediatric, of course, the age group.
So the parent should, if they feel that there is something wrong, they should go first to the clinic, which then the local clinic, which will then transfer them to the main hospital.
To the main hospital, according to the he will assess the patient. Whatever, for example, if he has abdominal pain, this is something medical like a gastroenteritis, or this is actually an appendicitis. So if he has a doubt, he will refer him to the general hospital, and then we will go and see this patient there. And if needs, of course, he comes to us and we will operate if necessary.
Sure. Dr. Suad, let us watch the Pediatric Mini Medical School graduation of 2016 and then return to our insightful discussion. The Developmental Pediatric League of Kuwait organized its third course of the Pediatric Mini Medical School, which took place over the months of March and April.
The course graduation event was held at Kuwait Medical Association, celebrated its graduates who attended the program to gain more information and knowledge about the field of child medical care. Among participants were not only specialists, but also mothers and students. This is the first program of its kind in Kuwait and the Arab countries. Here is more on this event in this report by Salim Al-Kandari.
The Developmental Pediatric League of Kuwait finalizes Pediatric Mini Medical School program in its third edition, with more participations from various groups and individuals.
I'm glad to say that today was the last day for the Mini Medical School, the Pediatric Mini Medical School. We conducted this awareness activity for the community members, from parents, teachers, to know about the health of their children. It was a series of lectures over the last 5 weeks, every Monday at night at the Faculty of Medicine. And as I said, the goal was to increase awareness about the health issues related to children and to correct the misconceptions. And gladly that the attendance was great, and today we concluded with the last 2 sessions about the stem cells therapy and the medications for kids, and we concluded with the graduation of the participants and honoring the speakers. So I would advise the public to take the medical informations from the good sources, so from the physicians themselves, because rumors are there. People will refer to friends' opinions which are non-proven. So I would always suggest that if they have anything related to the health of their children, they ask their pediatrician so that they get the correct information.
Well, it was my pleasure to participate in this very important event. I spoke about pediatric hematology oncology titles that I felt the community would need to be aware of some of the crucial points in this field. I think such conferences or presentations are very important for our community, because we really have a deficiency in patient or community awareness and community education regarding the basic information for their kids and for the community as a whole. So I think such events are very important to increase the level of education of our community. Well, my first advice for my colleagues, the specialties from different subspecialties, is to give some time for patients, to give some time for patient education in their clinics. It's very easy for me to write a prescription, but it's very difficult and time-consuming to explain and give the patient what they need and answer their questions and listen to their concerns. So this is what I advise my colleagues. I advise the community, don't take everything for granted. Always ask about the reasons, ask about why and when and what. So don't take all sayings for granted. Ask the specialist, ask the people whom you trust, whom are certified about specific subspecialty, to tell you what is the evidence behind any decision they would take.
The goal of the program was to bring together a group of distinguished professionals in pediatrics and pediatric-related specialists in Kuwait to share their expertise with parents, teachers, and other community members who were keen to learn more about child health. As we heard from the specialists and the doctors how important such courses are, that's what the presentations were, and the participants, they were able to learn from various medical advices and practically learn about how to take better care of our children. From Kuwait Medical Association, this is Salim Kandiri reporting for the Week in 30 Minutes.
Dr. Saad, welcome back to the program. You had a good attendance, mostly parents, right? Mostly mothers.
Mostly actually young mothers, which is, in a way, it's encouraging because you can see that the new generation, the new mothers, they want to learn, they want to be educated. And it's not just like, following what's going on the Instagram or the social media. So I think this is important. I wish that there is more and more, but I think in the coming years, hopefully
it's an annual event.
It's an annual event,
so
and we need more like announcements and attendance. Yeah.
What are some of the advice that you'd like to give to mothers? Maybe you can talk to us a little bit about the development of programs or development of tools, technology.
Well, I think the parents in general, because the kids, he wants the mother and the father, of course. So this is a cooperation between the two parental attitudes or managements. So I think what the kids wants to be cared for, wants to be, the parents has to be there for them. I sometimes feel very sad when I see that the kids comes in with the caregiver who are not the parents. So this is actually makes me very sad.
Of course.
So I think what we need the mothers and the parents, they want to be more aware about the common pathologies or disease that the kids can have, and how to deal with at home before sending him or take him to the hospital, and to be more around the kids. From the surgical point of view, I also described it in my talk during the event. We see a lot of kids, 3-4 years of age, and they are swallowing objects, like a disc battery or a needle, or toys or small things or a magnet. And this is very dangerous.
Needle?
Yeah, I was surprised that it's a needle and screw. And it's something that you'll think that how could a kid would swallow such a thing, and he's a normal kid supposed to be. But sometimes he wants to show some